Hello, my name is Vangie Dennis, and I'm the Director of Patient Care Practice for the Ambulatory Surgery Centers for the Emory Clinics. I want to thank you for your attention and for taking time out of your busy schedules. The purpose of this presentation is to provide you with an overview of one of our safety concerns occurring in the operating room. The Emory Clinics have 9 ambulatory surgery centers, and we perform over 42,000 surgical procedures yearly. Energy sources historically are the predominant surgical device utilized in surgery that involved head, neck, and chest procedures. Severe and fatal harm to our patients has been the result of these surgical fires. The awareness of education, the use of ignition sources, fuels and oxidizers present during upper airway surgery, and the precautionary measures can decrease the possibility for this type of surgical fire. What is interesting enough is more surgical fires are occurring than wrong site surgery. A collective team approach, the development of strategies, the implementation of education with policy enforcement and monitoring is imperative to ensure our ongoing safety. The U.S. Food and Drug Administration, or the FDA, in October 2011 announced that hospitals and ambulatory facilities should assess and implement a surgical fire prevention initiative. The Safe Use Initiative is an opportunity to establish alliances and partnerships with the suitable stakeholders in identifying risk and harm to our patients. The Joint Commission on the Accreditation of Hospitals publishes sentinel event alerts and recommends steps organizations can take to prevent surgical fires. ECRI, a nonprofit organization, and the Joint Commission estimate that there are over 650 fires occurring a year, causing severe injury and patient deaths. The Joint Commission revised sentinel event definition was developed in an effort to encourage operating rooms and staff to investigate and set a planned process when a fire occurs. Fires are not mandatory to report to the Joint Commission, but under the sentinel event policy, a root cause analysis should be conducted under all situations of an operating room fire. The ignition sources associated with surgical fires are electrosurgical equipment at 68%, lasers at 34%, and this is supported by an ECRI analysis. The number of surgical fires have increased over the last several years, according to the Pennsylvania Patient Safety Reporting System. The adverse events associated with airway fires are serious, and if not quickly extinguished, they can cause severe patient injury and death. This is why it is imperative that the entire surgical team, whether experienced or new, recognizes the hazards which can present with the use of ignition sources in an operating room with an oxygen-enriched atmosphere. Emphasis should be placed on awareness and education of the ignition sources, the fuels, the oxidizers during airway surgery, and the implementation of precautionary measures to decrease the possibility of this type of fire. The prevention initiative with surgical fires is a collective work between the clinical stakeholders and our safety organizations. These initiatives set by the FDA are to support safe practice with an interdisciplinary approach in developing interventions to prevent and decrease the potential for surgical fires. FDA published the initiative through the FDA Safety Communication on Preventing Surgical Fires. What is the value to the organization? It's the promotion of safe practices during surgery in order to decrease or eliminate harm to our patients. A conceptual culture of safety reinforced by a framework of practices supported by our leadership, interdisciplinary teamwork, evidence-based practice, communication, and patient-centered care is key to an organizational-wide culture of safety. Healthcare organizations have increasing pressures, and these are by federal, state, regulatory, and patients to validate a structural safety culture that assures patients are safe from medical mistakes. A data-driven model for the improvement of care prevents healthcare facilities for value-based purchasing and a compensation system where quality, the patient experience, and outcomes will affect reimbursement. The Centers for Medicare and Medicaid Services has specific clinical indicators related to fires and safety of the surgical patient. Surgical fires can result in severe or fatal injury to our patients. The healthcare team and education criteria are needed to understand the fire triangle and employ anticipatory measures to reduce the potential for this type of surgical fire. The metrics are standards to drive quality outcomes. The targets would be to set the goals to establish by the statistics from other centers of similar services and size. The data is reported quarterly with the overall comparative database against like systems' current data. CMS metrics are burns post-status surgery and the use of the surgical checklist. Measurement of the identified issue of the prevention of fires is for us to analyze trends and assess for high-risk areas and establish preventative protocol within practice. Again, policies, state and federal regulations, the professional organization standards, professional literature, and the manufacturer's recommendations are very influential to the level of care given in our operating rooms. Practices developed by a collective team with evidence-based metrics, strategy, and education can influence practice change. By facilitating a leadership style in the beginning phase, with the identification of physician champions and specialty nurses, can bridge an interdisciplinary approach to change. These specialties identify practices that can assist in the surgical setup and algorithms to decrease the potential for a fire. Anesthesia practice guidelines and nursing policies should reflect a combined approach to patient safety. Administrative support is vital to the execution of policies and assessing practices to ensure patient safety. The implementation phase includes education regarding the risk with ignition sources during airway procedures, education to the surgical team, and mandatory fire drills unique to the operating room. This multidisciplinary methodology supports in assimilating practices through all involved specialties and promotes safety. Quality practices suggest a patient-centered method that drives information at all levels for effective assessment and data detection. The primary objectives of no harm to our patients cannot be obtained without the combination of a culture of safety among the staffs and providers and the goals of the organization. The essential aspects of the strategic plan are to align the objectives with the mission and the vision of the institution. Developing strategies or connecting the areas to the strategic planning. And this requires the process to have a level of exploratory and rational skill. The American Association of the College of Nurses recommends strategic goals that incorporate the progress and the advancement of nursing, and the organization is to be the primary partner in the promotion of health, healthcare, and higher education. The strategic goal will be for the progression and the improvement in well-being, healthcare, and academic education. The emphasis is on increasing the quality metrics and showing a decrease in the incidence of the operating room fires. Key performance indicators, are commonly referred to as KPIs, are quality benchmarks utilized to compare statistical data against like systems. Key performance indicators include the preference of the management and the organizational goals, which define the strategic objectives. A sequence of steps taken is imperative so strategies can succeed and include the implementation of the education to the providers and staff, the development of anesthesia practice guidelines and nursing policies, the safety checklist to incorporate fire safety elements, and the criteria for universal protocol performed before the case. The three major essentials addressed in the action plan are the specific goals and objectives, the time frame and resources, which should be required to meet the strategic goals. Methodology for validating the test of change with fire safety in the operating room. to create a plan to test the change, which is referred to as plan. Follow up with the tests. Do observation and education from consequences, study, and determining what amendments and needs are with the test. Act. With the initiation of fire safety culture, the plan is to decrease the possibility of operating room fires and develop a test of change. The data collection is from the surgical checklist utilized in the preoperative and intraoperative areas of practice. The team takes the cumulative data collected over 6 months and analyzes the change in practice and fire intervention strategies. The ACT verifies the practice and cultural change among the healthcare team. The checklist utilized as a means of data collection through other studies have shown a 6-fold reduction in risk, with overall quality of the checklist and scenarios to be higher than average. The use of the surgical checklist improves the safety with operating room fires. Let's talk about the organizational functions, processes, and behaviors. A collaborative professional approach by the stakeholders will deliver a consistent message to leadership by identifying the challenges of change. When an organization is challenged with instability, there is an opportunity to develop new strategies, and this can be a stimulus for growth and development. Emphasis should be placed on awareness and education of ignition sources, fuels, and oxidizers during surgery, and implementing precautionary measures that can decrease the possibility of a surgical fire. The prevention initiatives with surgical fire is a collective work between the clinical stakeholders and the patient safety organizations. These initiatives set by the FDA are to support safe practices with an interdisciplinary approach and developing interventions to prevent and decrease the potential for surgical fires. A collective team approach, development of strategies, implementation of education, policies, and enforcement of those policies and monitoring is imperative to ensure ongoing patient safety. Our first role in preventing surgical fires is awareness. The surgical team should incorporate a fire risk assessment to determine if a case is at high risk of surgical fires. There should be communication between the surgical team, and this is critical in preventing fires. By involving in the administrative support and the change of practice and building a culture around the team moves the organization forward towards efficient quality of care. A collective leadership theory can provide valid and be relevant for nurses that also parallel with the missions and goals of the organization. It's important to communicate the risk of fire to leadership, identifying the issues, analyzing the trends for potential fire risk, and establishing preventative protocol that will validate the need to change practice. Exploring and reflecting on the types of evidence can effectively demonstrate the achievement of the goals when compared to similar historical processes. The stakeholders' strengths and weaknesses as related to formal and informal leadership skills can also impact transformation and significantly affect the outcome of change. The institution's vision and mission provide the direction for the future, and by specifying how the team integrates into the vision and mission must be clearly communicated to the stakeholders in order to move forward and get buy-in. The Commission on the Accreditation of Hospitals publishes sentinel event alerts and recommends steps organizations can take to prevent surgical fires. The Joint Commission revised sentinel event definition was developed in an effort to encourage operating room staff to investigate and set a plan and process when a fire occurs. The number of surgical fires has increased over the last several years, according to the Pennsylvania Patient Safety Reporting System. These adverse events associated with airway fires are serious, and if not quickly extinguished, can result in severe patient injury and even death. We need a conceptual culture of safety reinforced by contexts of practices that are supported by leadership, interdisciplinary teamwork, evidence-based practice, communication, and a patient-centered care is key to an organizational-wide culture of safety. Healthcare organizations have increasing pressures by our federal, state, and regulatory and patients to validate structural safety culture that assures patients are safe from medical mistakes. The safety outcome is the elimination of surgical fires by incorporating processes with checks and balances to prevent surgical fires from occurring. The key measurements are the initiation of the surgical checklist, the intraoperative fire risk assessment, the verification of sources that support fires, and preventative processes to intercept fires during surgery. Organizational change must focus on the various components of the surgical team with a collective initiative. The purpose of quality metrics is to achieve outcomes important to the team. The organization serves as support to allow the team to reach these results. A joint accountability strengthens the commitment level of both the team and the organization, allowing greater sustainability for the change initiative over an extended period of time. These metrics and goals should translate into the desired objectives by adopting new behaviors and changes in practice. Many change interventions assume an environment is characteristic of adjustment, but there needs to be cultural elements to permit that change in practice. By facilitating a leadership style in the implementation phase begins with the identification of physician champions and specialty nurses, bridging an interdisciplinary approach to practice change. Administrative support, it's also vital to the execution of our policies and assessing practices to ensure patient safety. The implementation phase includes education regarding the risk with ignition sources during airway procedures to the surgical team with mandatory fire drills unique to the operating room. Quality practices suggest a patient-centered method that drives information at all levels for effective assessment and data detection. The goal of no harm to our patients cannot occur without the combination of a culture of safety among the staffs and providers and the goals of the institution. Strategic planning and initiatives are ineffective unless it is comprehensible and aligns with the administration's goals and visions. Most importantly is how the plan is communicated. The institution's vision and mission provide the direction for the future, and by specifying how the team integrates into the vision and mission must be clearly communicated to the stakeholders in order to move forward and get buy-in. Efficient delivery of the objectives can be handled with effective communication skills and with valid and supportive data. The contribution of information is related to the exchange and the effectiveness of the delivery. The essential aspects of the strategic plan to improve outcomes would to be aligned with the objectives with the mission and vision of the institution. For Emory Healthcare, it would be quality at a cost-effective delivery. Emphasis would be on meeting the quality metrics and showing a decrease in healthcare cost. By engaging an interdisciplinary team in the overall goals, the metric could be evaluated from the providers and the healthcare team for clinical efficacy improved outcomes. The key performance indicators on quality are benchmarks with other like ambulatory centers. And by comparing the productivity, the efficiencies, the safety, patient satisfaction with the cost, data can support the quality directly impacts cost. The administrative stakeholders play an influence on developing open communication and dialogue built around the transparency of information. Key performance indicators can take into account the preferences of the management of the organization regarding the achievement of the defined strategic objectives. Group dynamics of biased opinions, clarity, hierarchical positioning, distance, dispersion, sincerity, information transmission, and inadequate communication skills can interfere with the vision of the strategic plan. So what are these? Well, biased opinions are based on one's experience and cultures, and by allowing each individual's views and ideas to the solution can facilitate sharing and will give each team member a chance to voice their opinion. But at the same time, live with open dialogue for others to engage even with that biased opinion. You may not always be able to convince the participants to see it your way, but you do not exclude the other participants either. Now, clarity is validated by an evidence-based support along with experiences. By promoting collaboration with a clearly defined approach towards achieving the goal and not a preconceived common assumption is essential while leaving the roles of the individuals within the team very open and flexible. This will encourage people to share ideas and contribute in multiple dimensions. And then there's the hierarchy in healthcare. And this is definitely complex. While there is a chain of commands, there should also be a transparency in delivering ideas without authority overriding the team's goal. There's no simple alternatives to the hierarchy in healthcare, as the culture of the organization sets the standard. A team facilitator can assist in defining the equality of the team and keeping the focus on the strategic plan. Sincerity, well, honesty and sincerity is an attribute of leadership. The key to the team dynamics is influence, not authority. Strong, informal leaders can guide the direction of the goals and vision. And trust is at the core of respect and honest people and can be counted on to follow through to their commitments. The team members work harder when they know they can trust, respect, and believe in each other. Establishing sincerity is not taught, but a consideration when selecting your team. Communication skills. Those skills can be enhanced with education and experience. Within my own system, Emory has a fair and just culture, which means everyone deserves and is treated with respect. We call each other on the behavior in a kind and professional manner. Effective communication skills are one of the most valuable life skills we can learn. The success of the strategic plan has to allow one to express ideas confidently and concisely. To overcome these different dynamics in achieving the goal can be an obstacle to the goal, and there is no one solution to these issues. There is constant and a growing complexity when no individual possesses sufficient knowledge or skills, and one of the biggest challenges of the team is developing patterns of effective communication. The future is not inevitable, and we have the power to invent it. The outcome measures should encompass essential fundamentals to support the operations and to ensure organized efforts. The collaboration among the disciplines influences the quality and safety of patients in the prevention of surgical fires. A shared governance approach to practice using evidence-based research is a recognized process to nurture partnerships, equity, accountability, and ownership. Outcome measurements and initiatives are ineffective unless the metrics are in line with the administration's goals and visions. Organizational culture definitely has an impact on the support and the implementation of the practice. In order to move an organization forward, the barriers to a transparent organization facilitates a culture change without the fear of a punitive response. Barriers to transparency need to be ingrained in our healthcare culture. Characteristics of providers and team regarding transparencies are fears about conflict, disclosure, and negative effects on reputation and financial impact. Promote accountability by clear and complete information to safe and appropriate care. By driving improvements in safety, the team learns from mistakes. By promoting trust, as transparency is the core of the patient relationship. Facilitate choice with full, honest, open communication so our patients can make informed decisions. Characteristics of providers and the team regarding transparencies are fears about conflict, disclosure, and adverse effects on reputation and financial impact. A leadership which is educated and ingrains a non-threatening environment is required to overcome the barriers and create a culture of safety. Supporting the plan for a culture of safety. Communication and relationships are strong characteristics when trying to facilitate change. Whether you're in staffing, middle management, or administration, it's imperative for a successful implementation of the strategic goals when engaging a team. The American Academy on the Communication in Healthcare has prioritized research and education for relation-centered healthcare communication. The focus on improved communication can improve clinical quality indicators, open the lines of communication with improved clinical satisfaction and patient satisfaction, create an integration of improved teamwork, and increase patient safety scores. In clinical practice as nurses, we rely on effective communication skills, and this is imperative to the outcomes of our patient satisfaction and optimizing care. The Institute of Medicine supports a need for collaborative team dynamics in order to open the lines of communication amongst the healthcare team and to enculturate an environment of safety. The healthcare teams of today need to move away from compartmentalized decision-making to the integration of collaborative practices, and the organization needs to be open to input from all caregivers and encourage transparent, transformational communication. Assessing the elements of performance for the strategic plan is to support the goals. How does this align with the visions of the organization, the relationship with management, communication skills, and facilitation to involving an interdisciplinary team? It's also very important to reflect and identify issues. Analyze your trends for high-risk areas to establish preventative protocol. When the team focuses on statements that are specific, measurable, obtainable, and pertinent, and within a specific time frame, this will promote high-quality learning culture. Exploring and reflecting on the types of evidence can effectively demonstrate the achievement of goals when compared to similar historical processes. Reviewing the process can assist the team in assessing the evidence and provide meaningful feedback. Lastly, reflecting on a situation or project with feedback sets the climate and plan for a positive change. By creating a vision, followers are energized to join the goal in making the vision a reality. In conclusion, it's important to communicate and understand the risk of fires, identify the issues, analyze the trend for potential fire risk, and establish preventative protocols. By exploring and reflecting on these types of evidence, we can effectively demonstrate the achievement of the goals when compared to similar historical processes. The institution's vision and mission provides the direction for our future, and by specifying how the team integrates into this vision and mission, clearly communicates to the stakeholders and allows us to move forward and get buy-in. The Center for Medicare and Medicaid requires clinical indicators that are reportable at all ambulatory centers, and CMS targets are set measurements for key performance indicators. These metrics are standards to drive quality outcomes. The CMS metrics are burns, post-status surgery, and the use of the surgical checklist. Practice change is a quality and safety initiative as the result of CMS clinical indicators of fires, and safety is related to the surgical patients. Ignition sources are the sources of energy in the majority of our surgical procedures for upper airways. Surgical fires can result in severe or fatal injuries, and the healthcare team needs to be educated to understand the fire triangle and employ anticipatory measures to reduce this potential type of surgical fire. Our policies, our state and federal regulations, our professional organizations, our standards of care, professional literature, and the manufacturer's recommendations are influential to the level of care given in the operating room. The safety of our patients involve the understanding of the possible hazards, advanced planning to practice, open communication, and emphasis on prevention, as surgery is an inherent risk, and not all precautions will eliminate the possibilities of ignition-induced injury. The essential aspects of the plan are to align the objectives with the mission and vision of the institution, and let us establish a culture of safety. Thank you so much for your time today, and I will open the floor for questions.